Basically, what it allows you to do is say that a patient is at a certain point in their disease, and that this is really how they should be treated, and this is what we can expect in terms of their outcome. So it's kind of a way of summarizing, at what stage they are at. That's why we call it a stage. And basically, why do we use stages? Well, what this does is we can very quickly communicate to another physician or a colleague that they're at this stage, and it automatically implicates certain parameters in terms of what can be expected. So usually stage 1 and 2 in most diseases, what are called clinical stages. So clinical stage 1 and 2, they're relatively lower stage, better survival, and usually cured with surgery or something a little bit less systemic. And then 3 and 4, these are more advanced. So those are what we're calling clinical staging. Now, a pathologist does not perform clinical staging. We perform what's called pathologic staging. So what a pathologic stage is, basically, because we only look at the level of tissue and of tumor, and we only see the tumor, we don't see the whole patient, but we can tell you a lot about the tumor. So the tumor itself is present or is progressed to a certain stage, the pathologic stage. So what we do is the combination of the T stage, which is the tumor stage, the nodal stage, which is where if the tumor has gone to lymph nodes, and the metastatic stage, the M. The combination of those parameters gives you a clinical stage. So you have individual pathologic stages that then give you a clinical stage. However, different pathologic combinations can give you the same clinical stage. And the way they figured that out is they said, well, let's look at 1,000 patients with lung cancer. The ones which had this node positive, this size tumor, and this type of metastasis had this number of months of survival. So they basically were able to create a mathematical model so they could look at how the stage reflected what was going to happen to them. And they found that there were very consistent results, that usually patients that had these combinations of findings did this happen to them, and that this type of treatment seemed to be a better option for them. And this is how they came up with the idea of stage, is that it was all based on survival data. So when you look at very basic articles on staging, this is how they had originally calculated the best cutoffs for the different stages, is based on how the patient did, the survival data. And people ask about, oh, well, the information we get about stage seems to be fairly inconsistent. There's one authority, which is WHO, World Health Organization, and they really write the definitive guides and the agreed upon consensus staging criteria for all the different types of diseases, including lung cancer. And so this book, which is put out by the WHO, will summarize what a pathologist, for example, this is the pathologic book, will summarize what a pathologist needs to look for in order to diagnose a certain type of cancer, and how to outline the stage of the tumor. It's put together by a series of world-known experts who've come together in a panel and who come up with a consensus on the best system for classification. And it's usually updated every maybe 10 years. This book I have here is from 2004. I know that there was a lot of staging that got upgraded or updated in 2007 on lung cancer. So there were some major changes that they found out. So some of the changes include that certain patients that were called a stage 3 in the old system, actually when you really looked at how they survived or how they did, they thought, you know what, these patients actually did better than what we thought. I think they need to be stage 2. So for example, some criteria became less, the cutoff changed for some of these patients, so that what would have been called stage 3 in the old is called stage 2. And it's because they looked at survival data and they looked at newer data and found out that their older model did not predict actually what was happening. And even now, they're continuing to look at all the new data of patients to make sure that the staging mathematical model fits reality.